Pharmacological therapy in treatment of lipid disorders. I think earlier on we looked at the non-pharmacological therapy. Now, non-pharmacological therapy is mostly what? Lifestyle modification. If you are taking food that are giving you too much cholesterol, then you reduce it. If you don't do exercise, you start doing exercise. If you haven't gone for a test, then you should go for a test and all the stuff, right? Then for pharmacological therapy, it's more of like you introducing drugs into the treatment for lipid disorders. All right. So pharmacological therapy in treatment for lipid disorders, right? So for pharmacological therapy, let me see. Okay. So lipid disorders, when you're saying lipid disorders, you're actually talking about what? If cholesterol levels are high or if triglyceride levels are high. That's why we have this place for predominant hypercholesterolemia. Then this side we have it for what? Predominant hypertriglyceridemia. Okay, so different drugs actually apply to the two concepts. For the predominant hypercholesterolemia, you can use statins. So you can go ahead and check for what? The pharmacology of each of these drugs, right? Like lovastatin, simvastatin, rosuvastatin, atorvastatin. Alright, this is how statins look like. Then you can use what? Cholesterol absorption inhibitors like what? Ezetimibe. This is ezetimibe. It will basically stop the absorption of cholesterol into what? The body. Alright. Then you could use nicotinic acid, which is Niacin. Nicotinic acid. Then you can use what? Bile acid sequestrant, like what? Cholestyramine. Alright. Is bile acid sequestrant. Alright. Then moving to, that was what? Hypercholesterolemia. Then moving to hypertriglyceridemia now. You can use drugs like what? Fibrates. Alright. Examples of fibrates, we have them as fenofibrate and gemfibrozil. Alright. Then you can also use a highly polyunsaturated long chain and 3 fatty acid. Okay, all those could actually help. Then for patients that have high levels of cholesterol and high levels of triglyceride all together, they use combined therapy. All right, and the most preferred combined therapy is what? You combining statins with fibrates. Okay, actually works a lot. All right. So I think that's it for this pharmacological therapy for treating what? Lipid disorders.